Now, 1 in 5 Australians lives with chronic pain, sadly, and a new study says many also face a heavy financial burden to add to their suffering.
Dr Coralie Wales is President of Chronic Pain Australia, and she joins us now from Sydney. Coralie Wales, good morning.
Good morning.
What sort of chronic pain are we talking about?
Chronic pain is pain that lasts for more than 3 months, and it's the sort of pain, it's not to do with the severity. It can be chronic non-severe, it can be chronic severe, and it can be chronic disabling. Any of those are in the category of chronic pain.
It can be absolutely debilitating, and we're sorry about the sounds that we hear in the background there. If we decide that you're not safe, we'll send you out for that drill. But does that mean that chronic pain, so for example, if you suffer from rheumatism or rheumatoid arthritis and the like, are you categorised as having chronic pain, or is
Absolutely.
that taken out and then treated as its own category and its own disease?
Chronic pain can be caused by all sorts of things, Virginia. It can be a disease-related pain, or it can be pain with very little to explain it medically. Chronic pain is often about the nervous system and the immune system getting really involved.
Right.
And it can be quite complex.
So is it a life of painkillers and a life of simply enduring all of that? And I guess that just must be a very wearing, debilitating and expensive life.
All of those things. Interestingly, those 3 words, debilitating, exhausting and frustrating, were the 3 words that people continue to use most often to describe their pain. And this is really about the impact of chronic pain on your life. Financial, well, we found that asking the same questions in 2009 as we did just recently, that people are spending a lot of money on just existing with pain, just managing their pain. Increasing, I think, double the amount of money that they're spending on their medications and treatments, and of course time not working. So it's quite significant.
Time out of the workforce would be significant as well. It also must take a big physical toll on you, or simply enduring that pain, but also the amount of medication that you have to take must be potentially quite dangerous for some too.
I think the problem with medication is that if chronic pain has affected your life to the extent where you're not working anymore, you become quite impoverished. And when we asked our community about that, they said, well, we can't afford treatments, but if we've got a healthcare card, then we can access medicine. So it becomes a question of access. What can people access?
Yeah.
You go to your GP, the GP system, the systemic factors around a GP, mean that a GP doesn't spend much time with you, and of course people with chronic pain really need a team around them, a holistic approach, looking at physical, emotional, social, medical factors that can have a huge influence on whether or not you can manage your pain.
And can you have a good outcome from having that holistic team around you? Have we seen evidence of this?
Absolutely. The evidence is all pointing in the same direction, and that is that we need to do this together. We need all the primary care clinicians wrapping around that person and listening to that particular person's story, because that will have a lot of meaning for how we might do some therapeutic approaches, and listening takes time. I think some teams are doing it better than other teams, but really the system around primary care is not conducive, as you know. It's really for acute problems, not for chronic and complex problems.
So you're calling on GPs to actually take that broader approach and try and incorporate the other approaches and the medical services outside of doctors to join them?
Yes, there are models that can help GP practice, and there are resources that can help GPs better handle their patients with chronic pain. The nationalpainweek.org.au website, we've been building a bit of a repository of resources that are free for GPs to access, including helping patients understand their pain. It's a huge step. If you understand what's causing your pain, you're more likely to be able to manage it. Just that unpacking of what's going on. What's the nervous system doing? What's the immune system doing? How does this work? And how might I take small steps to achieve it? Certainly at the major conference next Friday, we've got a great example of a woman who has spent the last 3 years with a team, having been only able to walk on a walking stick. she's now, she achieved her goal a couple of weeks ago of climbing the Sydney Harbour Bridge. And it took her 3 years, and it was tiny, tiny steps, and a team that really supported her to take those steps, and she's now quite a fit woman.
That's a great story. Yeah, Coralie, look,
me.
good to talk to you this morning. Good luck for the conference, and thanks for talking to us.
Thanks very much, Virginia.